What if I told you, that one of the most powerful health checkups you can do, costs absolutely nothing, takes less than 10 seconds and happens every single day. No doctor's office, no needles, no copay, and most of us, and for our entire lives, have been flushing it away without a second glance. I'm talking about your poop. Now, before you reach for that remote, stay with me, because what's happening in your toilet bowl is one of the most honest conversations your body will ever have with you. And for seniors especially, learning to listen to that conversation could literally save your life. Today, we are going to decode every shape, color, texture, and type of stool, what each one means, what problems it's warning you about, and what you can do about it. All explained by the wisdom of Dr. Hiroshi Sato, one of Japan's most respected gastroenterologists. Stay until the end, because what Dr. Sato calls the perfect poop might completely change how you think about your health. But first, real quick, if you're new here, welcome. We make videos that talk about the health topics most doctors don't have time to explain in a 10-minute appointment. Hit that subscribe button right now. It takes literally 1 second. Pause and smile. What city or country are you watching from right now? Type it below. I read every single comment. Whether you're in London or Lagos, Toronto or Tokyo, Texas or Taipei, tell me where you are. It's always amazing to see how far this community reaches. All right, let's get into it. Here's something your doctor may not have spelled out clearly. As we age, our digestive system changes significantly. The muscles in the colon weaken. The gut microbiome shifts. Medications, blood pressure pills, pain relievers, antidepressants, diabetes medication, all of them affect bowel habits. Hormonal changes after menopause slow down digestion, and nerve signals in the gut become less sensitive, which means you might not even feel a problem developing until it's quite advanced. This is why monitoring your stool becomes increasingly important. Not obsessive, just aware. Doctors use a clinical tool called the Bristol stool chart, developed by researchers at the University of Bristol in England. It identifies 7 types of stool. Each type tells a different story about what's happening inside your digestive tract. Let's walk through each one. Type 1 looks like small, separate, hard pellets, almost like rabbit droppings or little marbles. They are difficult to pass and may cause straining or even minor bleeding. What this means: this is severe constipation. The stool has spent too long in the colon. Your body has absorbed almost all the moisture from it, leaving behind dry, compacted waste. Health warning for seniors. Chronic straining like this puts serious pressure on your heart, particularly dangerous if you have cardiovascular issues. It can also cause or worsen hemorrhoids, anal fissures, and in rare cases, rectal prolapse. Solution: increase water intake immediately. Aim for 6 to 8 glasses daily. Add soluble fiber. Oatmeal, flaxseed, prunes, apples with skin, light walking after meals stimulates bowel movement. Talk to your doctor if this persists longer than 3 days. Avoid long-term laxative use without medical guidance. Type 2 looks like a sausage or log, but the surface is rough and lumpy. It comes out in one piece but requires effort. What this means: mild to moderate constipation. Stool is moving too slowly through the colon. Health warning for seniors. Slow transit constipation is common in older adults due to reduced physical activity and certain medications like opioid pain relievers and iron supplements. Over time, chronic slow transit can cause toxic buildup and increased risk of diverticulitis, small pouches in the colon that become inflamed and infected. Solution: review your medications with your doctor. Something may be slowing your gut. Add magnesium-rich foods, leafy greens, seeds, whole grains. A gentle morning routine, warm water with lemon upon waking, can stimulate digestion. Probiotics like yogurt or kefir support a healthier gut microbiome. Type 3 is sausage-shaped with some surface cracking. It passes more easily than type 1 or 2. What this means: this is at the lower end of normal. You're close to ideal but slightly dehydrated or low on fiber. Health warning for seniors. Not an emergency, but a nudge. Pay attention to your fluid and fiber intake. This is your gut's early warning system saying, drink more water and eat your vegetables. Minor adjustments: 1 extra glass of water per day. Add a fruit serving to your morning meal. This type often corrects quickly with small habit changes. Type 4 is the gold standard. A smooth, continuous log. Easy to pass, no straining, no discomfort. What this means: your digestive system is working beautifully. Transit time is healthy, hydration is good, and your microbiome is balanced. For seniors, this is the goal. If you're here consistently, keep doing what you're doing. And we'll talk more about this when we get to Dr. Sato's definition of the perfect poop at the end. Type 5 looks like soft, separate blobs with defined edges. They pass easily, sometimes too easily. What this means, you're on the edge of loose stools. This could indicate a diet too low in fiber, mild food intolerance, or early signs of irritable bowel syndrome. Health warning for seniors. If you notice this regularly, consider whether you've recently changed your diet, started a new medication, or eaten something unusual. Also, watch for dehydration. Loose stools mean your body is absorbing less water. Add more binding foods. Bananas, white rice, boiled potatoes, toast, reduced caffeine, alcohol, and artificial sweeteners all can trigger loose stools in sensitive older guts. If it persists beyond 2 to 3 days without an obvious cause, see your doctor. Type 6 is mushy, soft, and falls apart, almost no defined shape. What this means, this is mild diarrhea. Your colon is moving things through too quickly for water to be properly absorbed. Health warning for seniors. This type is particularly concerning for older adults because it can lead to rapid dehydration, a serious and dangerous condition in seniors. Electrolytes, sodium, potassium, magnesium are lost quickly, which can cause dizziness, heart irregularities, and confusion. Hydrate urgently with water and electrolyte solutions, not just water alone. Brat diet, bananas, rice, applesauce, toast. If it lasts more than 48 hours, you are on blood thinners or you have kidney or heart disease. Call your doctor. Do not wait. Type 7 is completely liquid. Watery diarrhea with no solid form at all. What this means, acute diarrhea. Your colon is not absorbing water at all. This can be caused by a virus, bacteria, food poisoning, severe reaction to medication, or in more serious cases, an inflammatory bowel condition or infection like C. difficile, which is more common in seniors who have taken antibiotics. Health warning for seniors. This is a medical situation. Do not dismiss it. In adults over 65, acute diarrhea combined with fever, blood in stool, or confusion is an emergency. Seek medical attention if it persists beyond 24 hours in a senior. Watch for signs of dehydration, dry mouth, dark urine, dizziness, rapid heart rate. Do not take over-the-counter anti-diarrheal medication without asking your doctor first. In some infections, stopping the diarrhea too soon traps the bacteria inside. Beyond shape and texture, color is a critical signal. Brown, normal. A healthy, balanced diet produces medium to dark brown stool. Yellow or greasy could indicate issues with fat absorption. In seniors, this may signal a pancreas or gallbladder problem. See your doctor. Green, usually harmless. Leafy greens, green food dye, or fast transit time. But persistent green stool can indicate infection. Black or tarry, this is serious. Black, sticky stool that looks like tar often indicates bleeding in the upper digestive tract. Stomach or small intestine. This is a medical emergency. Call your doctor same day or go to the ER. Bright red could be hemorrhoids, common and usually harmless, or could indicate bleeding in the lower colon or rectum. Don't assume it's just hemorrhoids. Get it evaluated, especially if it's new or recurring. Pale, white, or clay-colored. This is a warning sign for the liver or bile ducts. Bile gives stool its brown color. If stool is pale, something is blocking bile flow. See your doctor promptly. Rule of thumb, any unexplained change in stool color that persists for more than a few days deserves a call to your doctor. Now, let's talk about something wonderful. What does ideal actually look like? Dr. Hiroshi Sato is a leading gastroenterologist based in Tokyo, Japan. He has spent over 3 decades studying digestive health, and he's worked extensively with aging populations. His research draws heavily from Japan's remarkable longevity statistics. The Japanese have among the longest, healthiest lives on Earth, and Dr. Sato believes gut health is a significant reason why. According to Dr. Sato, the perfect bowel movement has 5 qualities. 1. Shape. A smooth, continuous log. Bristol type 3 or 4, no cracks, no separate pieces, no liquid, like a soft banana. 2. Color, medium to golden brown, the color of milk chocolate or caramel. This reflects healthy bile production and good transit time. 3. Length and size, roughly 10 to 20 centimeters, about the length of your hand, not pencil thin, which can signal narrowing of the colon, and not abnormally large. 4. Sinks gently. The ideal stool sinks slowly or briefly floats before sinking. Stool that always floats may indicate excess gas or fat malabsorption. Stool that sinks instantly like a rock suggests density from dehydration. 5. Passes easily and completely. No straining, no sitting for long minutes, no feeling of incomplete emptying afterward. Dr. Sato says the ideal bowel movement should take no longer than 1 to 3 minutes. If you're reading a novel on the toilet, your gut is asking for help. Dr. Sato also emphasizes timing and regularity. He does not insist everyone must go once daily. Some healthy people go twice a day, others every other day. What matters is your personal consistency. A sudden change in your normal pattern, that is what should raise an alert. His advice for seniors seeking perfect bowel health, he calls it the 4 pillars. Water, at least 1.5 liters per day, more in warm weather fiber, a mix of soluble and insoluble. Oats, vegetables, fruits, whole grains. Movement, even a 20-minute walk after meals dramatically improves transit. Fermented foods, miso, yogurt, kefir, kimchi, the Japanese principle of feeding your gut bacteria. Well, Dr. Sato closes with this thought, and I want you to really hear it. The bowel is not an embarrassing topic. It is the mirror of the body's inner life. In Japanese medicine, we say, a person who pays attention to their stool pays attention to their life. These are not separate things. So, next time you visit the bathroom, take 3 seconds. Look, notice. Your body is always communicating with you. It never lies, it never exaggerates, it only asks for your attention. If anything in today's video made you stop and think, please share it with someone you love, a parent, a spouse, a sibling, a friend. This information is free and it could matter more than they know. And don't forget, drop your city and country in the comments below. Let's see how far this community reaches today. Take care of yourselves, take care of your gut, and I will see you in the next video.